afternoon, everybody. Thank you so much for being here. My name is Deborah Friedman. I'm Assistant Commissioner for Workforce Engagement and Innovation, and we're really excited to have you all here to learn more about what all of our city employee staff are telling us about the work that we're doing at our agencies. So before we get started, I want to just introduce the team you'll be hearing from today. So we can go to the next slide. We have Priya Islam, our Senior Evaluation Analyst, Ebony Brown, our Engagement Coordinator, Ayana Mbonu, our Assistant Director for Outreach and Engagement, and Nadia Turnage, also our Engagement Coordinator. And so these are many of the people who you might know or are behind the scenes doing extraordinary work of WorkWell. But before we turn it over to the presentation today, I just want to invite our commissioner, Renee Campion, to say a few words of welcome. Renee?
Yep. Can you hear me okay, Deb? Great. Thanks. Yeah. Hi, everybody. Hi, fellow executive leaders. So thrilled to be here today. So thrilled to see all of your faces and names on the screen. You know, I was able to take a quick look earlier today at my Pulse survey summary. And it is, you know, very interesting. There's very, very interesting. I know internally here at OLR, I'm going to be speaking with my deputy commissioner, my first deputy, Dan Pollock, about our group. And I know you're all very interested in learning more and getting more information about your own. So really with that, I just want to turn it over to Priya. And I think this will be a really interesting conversation and a great takeaway, take back to your agencies to learn more and figure out how we can engage with our employees more. So Priya.
Thank you so much, Renee. And thank you everyone for joining us today. We're super excited to share some of these results and as well as to get into the discussion later today. So I know that many of the folks on the call may have been also part of the executive leader briefing last month, where we talked about the Pulse survey results. But, you know, just as a refresher for the folks on the call and maybe for folks who may have missed the initial presentation, we'll talk a little bit about a couple of key takeaways from the Pulse survey and then go into a few data considerations for your specific agency reports. And then we'll jump into the Q&A section. If you have any questions while I or any of my colleagues are speaking, feel free to put it in the chat and we'll get to those at the Q&A section. So with that, I'll start it off by saying that the Pulse survey was conducted this year between February and April of 2024. This was WorkWell's third Pulse survey, and the purpose of the Pulse was to get a sense of needs and priorities of our city employees. This year we were able to get over 5,500 total responses with 200 plus executive leaders that responded as well to the Pulse survey. We had 64 agencies that were represented and 31 agencies that reached the 5% employee headcount. And as a reminder for folks, we put out an incentive that if you were able to reach 5% of your employee headcount, you would get an agency report. And that's why we are all here to discuss those reports. And I'll just say as a quick aside, there are a few agencies that, although they reached the 5% headcount, they did not receive reports. And that was due to the small sample size at their agency. And for those agencies, you should already know who you are and you've been contacted about that. And we are going to be working with those agencies to see what kinds of support that we can provide. So with that, some of the key sections for the Pulse were, perceptions of WorkWell, but also worksite wellness programming generally, agency climate and work environment. We also surveyed on employee health and health outcomes, executive leader feedback, and then finally recommendations for agencies. So first, here are a few key takeaways from the perceptions of workplace wellness programming, agency climate, and work environment. So first, the majority of city employees are familiar and benefit from worksite wellness programming. We found that approximately 3/4 of employees noted that WorkWell does support their healthy lifestyle goals. We also found that in terms of work environment, there were many positive reports, with approximately 90% of survey respondents reporting that they had positive relationships with their coworkers and reporting meaningful work overall. For agency climate, we found that there were fewer reports of wellness being supported. So what that means here is that we found that 42% of employees felt that their supervisor cares about their health and well-being, while 34% felt that their agency leadership was committed to their health and well-being. We also found that WorkWell NYC participants were actually more likely to report feeling supported. So supported by their agency leadership, but also feeling that their supervisor cares about their health and well-being. Now, moving on to employee health and health outcomes, we found that WorkWell NYC does support city employee health and wellness, with 1/3 of respondents noting that they increased their physical activity and attended more to their health and well-being due to participating in WorkWell NYC programs. For employee health, we found that the majority of participants, so almost 8 out of 10, reported excellent, very good, or good health. For physical health in particular, the top reported health conditions were overweight/obesity, mental health/emotional health issues, and diabetes. And for mental health, we found that 60% of city employees that responded to the survey reported being burnt out. And again, that can include a lot of symptoms of burnout, or feeling completely burnt out. And I listed here some of the top work factors that significantly impact stress. And these could include lack of opportunity for growth and advancement, salary, et cetera, and uncertain job expectations. And then finally, how executive leaders responded. Again, we had over 200 executive leaders respond to our survey, and we found that some of the ways that executive leaders support worksite wellness at their agency include attending wellness programs and encouraging staff to attend, engaging leadership to promote programs, and supporting their agency wellness committees. Some of the supports that executive leaders reported that they need include higher level leadership support for wellness activities, more communication and suggestions for programming at their agency, as well as funding for wellness activities. One of the main takeaways of this section that we also discussed at the last briefing in September was this disconnect that we found between employees and executive leaders surrounding agency climate. So you can see here that 84% of executive leaders reported that that their agency makes wellness a priority. And that is in contrast to non-executive employees that reported that leadership, only 34% reported that leadership is committed to their health and well-being. So that was something that we wanted to highlight to see that there is a disconnect between executive leaders and the average employee. Now, I went through that fairly quickly. And again, these were just a few quick highlights from our presentation. This slide deck will also be shared with the folks on the call after the meeting. And we have links to the recording from the presentation from last month that I was just talking about, as well as the slide deck. So if you want to look at the information that I just showed in more detail, feel free to take a look at those resources. Now, moving on to data considerations for your agency's pulse report. So first, folks on this call should have received an Excel file from my colleague, Ebony Brown. And the attachment should have had a agency-specific pulse report. And I took a screenshot of what the cover page of this report looks like. So you can see on the left side of the screen, it starts off with a cover page with some information just about the areas covered, which I'll also will go over. And then there are a few different tabs at the bottom of the Excel workbook for different sections included in the report. And so those sections include employee health, wellness programming, agency climate, and executive leaders. So similar to the data that we just summarized for the citywide report. All right. So some overall considerations when reviewing your agency pulse report. The first is, again, reiterating that due to confidentiality concerns, the following topics were omitted from each of the agency reports. Employee demographics and write-in responses. We wanted to be very sure that no individual could be identified with the data. And so because of that, we decided to omit those two sections from the report. Additionally, any questions that had less than 5 responses were omitted. If there was any question that was omitted from your agency report, it is still listed, meaning that the question will still be in the report. So there shouldn't be any kind of confusion of like, oh, I wonder what questions are missing. In your report, it should be clearly kind of delineated, like where it says like this question was omitted, if any. And then lastly, interpreting question types. We'll review those in a moment, but we'll talk about select all that apply responses and write-in categories. But before we get into that, just a few other considerations. The first is total sample versus section sample. So you may notice that on the cover page of your agency report, there's a little box that looks like this that will say like your agency acronym. So, for example, OLR. And then it would say, the agency pulse report and total sample. And to make this, easy for folks, we'll keep it at 100 for this sample agency. So this total sample indicates the number of employees from your agency that responded to any question in the pulse. So 1 or more questions in the pulse survey. However, you may notice that when you go into the other tabs of the Excel file or you look at particular questions, the total sample number may not match. And so for this example, for the section agency climate, the employee sample is 95. So what that means is that 5 less people responded to this section. Those 5 extra people may have responded to other questions or sections of the pulse. And again, to reiterate that responses to individual questions or survey sections may vary. The total number of responses for your agency should be indicated for each individual question. And none of the questions in the pulse survey were required. So it's really up to the employee what questions they chose to respond to. Now moving on to select all that apply questions. So you may notice that there are a few questions in your report where the percentiles do not add up to 100%. And for those questions, and for example, I use this one, which topics are you interested in seeing from WorkWell? There should be a parentheses that say select all that apply. Any select all that apply question will not have percentiles that neatly add up to 100%. And the reason for that is being that it's select all that apply, any employee could have responded to one, all, or any combination of responses that you see here. So for example, for these topics that I'm interested in, maybe I would have selected women's health and meal prep, but maybe not some of the other ones. So because of that, the percentiles will vary, and they're based on the number of people who answered the question. So if you see that they don't add up to 100%, that is okay. Additionally, there are questions where we did add in write-in themes. I mentioned a moment ago that we didn't add in any kind of individual write-in response. However, there were some responses that we were able to kind of categorize into themes, and we indicated that here for this question in gray. So for example, you'll see that in the gray categories for the topics that folks are interested in, we have, mental, emotional health, yoga, meditation, etc. And what I'd like to emphasize here is that just because the percentiles are small doesn't mean that your employees are not interested in these topics. It just means that they did not write in that they're specifically interested. And WorkWell, we did not include some of these options in the initial kind of categories for topics that folks could be interested in, partially due to the fact that we actually already offer programming in these areas. So for example, for mental emotional health, yoga, meditation, stress, financial literacy, WorkWell does offer programming in these areas. But again, you might want to do a little bit more digging at your agency to see if these are topics that folks are particularly interested in. Now, moving on to missing data. So in your agency reports, you may notice that there are certain questions or entire sections that are missing. The most common section that I found that was missing were executive leader feedback. And again, if any question or section had less than 5 responses, we would have omitted that from the report because that data is not really significant to share. However, in this example that you can see here on the left, for this example, there were 0 executive leaders that responded. We will still indicate the number of people that responded to this section, even if we don't omit the actual questions. So if you don't have data for a particular question or section, we would like to recommend that you utilize the citywide data as a starting point. And so on the right side of the screen, I put in the citywide data example where we had, again, 202 executive leaders who responded to the sample. And then you can take a look and see the percentiles for the question, does your agency make a wellness a priority? And again, you can use that as a starting point and you compare to your agency. But again, noting that every agency is unique and you might need to do a little bit more internal digging on your own to figure out how folks feel about these particular items. So now comparing to citywide data, on the left side of the screen, I put an example, a sample from the agency. And this is for the question, do you know where to go for support for mental health issues? Now, I highlighted here the yes percentile, which is 32%. You might see this in your report and say, okay, now what? How does this compare to citywide data? What can I do from there? So as a start, you can take a look at the citywide data, which was also provided to you. And on the right side, you can see here, I highlighted the percentile of the yes percentile for the folks who said that they do know where to go for support. And so if we're just comparing the yes percentiles, for this example, we can see that the agency data shows 27% less yes than the citywide data for knowing where to go for support for mental health issues, which again, you can use as a starting point for identifying opportunities at your agency. Maybe you can share more resources about mental health, make them more visible. Again, that is one way that you can use the data. However, there are some other considerations when comparing to the citywide data. The citywide data that was provided includes a section called missing. We provided this in the citywide report for the most kind of accuracy, so folks could see, what percentage of employees didn't answer a particular question. So for comparison, it might be a little bit, it might add a little bit, another layer for comparing your data, because again, for this example, let's say there were 100 employees, you could see that there were 5 people who didn't answer the question. So in your agency report, all the sample size numbers are listed. So if you wanted to, you could recalculate this by adding a line, putting 5 people missing, and recalculating the percentiles if you wanted to go down that route. Otherwise, you can kind of just take this with the consideration that although in this example, almost 60% said that they know where to go for support for mental health issues, it's likely that this percentage is actually higher if you don't include that 20% who said the data was missing. Now, I know that this may be confusing to folks, or you might have additional questions. So again, feel free in the Q&A to ask, and I'm happy to re-clarify and reach out to me directly if you have very specific questions about the data here. One other consideration to consider when you're comparing your agency citywide is just the diversity of all of our city agencies. The agency that I work at, OLR, is quite different from, I'm sure, many of the other agencies that folks are representing here on this call. So it's important for you to dig deeper with your own workforce and see what are the issues and concerns that really impact your agency, and considering how your agency operates when interpreting the data. Okay. So right now I'll turn it over to my colleague, Ayana Mbonu, to talk about next steps and to kick off the Q&A.
Thank you, Priya. So we'd love to hear from you. We'd love to hear some of your thoughts. I'm checking the chat right now, and I don't see any questions. So we'd love to hear what your thoughts are. Have you had it?
And I'll add, oh, sorry, Ayana. And I'll add that this is the first time that we are, we've kind of embarked on this project, and this is a learning experience for all of us. And we really want to know your feedback. If there are portions that, could be better explained, let us know. If you really felt like the data was useful and you'll be able to share this with your leadership team and your agency, also let us know. We're interested in any and all feedback that you have.
All righty, so it looks like we do have one comment. Michael is saying that the importance of leadership to be involved and stay involved. I guess that's one of your large takeaways from this report. All righty, awesome. Okay, so we have some recommendations. I know, Priya, you did mention we got one question beforehand that you wanted to share.
Yeah, I mean, after the recommendations, we can start the Q&A and I can mention it there.
Okay, awesome. Alrighty, so recommendations for from our city employees. More support. So lots of employees said they would like more support from leadership and opportunities to share ideas and concerns. They mentioned they'd love to improve their workspaces, have access to resources to do their work. So what those resources are, that's a great question for you to pose to your employees. Improving work culture and morale. That's some of the recommendations that city employees mentioned in the report. And recommendations from us, we think that it's really important to identify your executive wellness sponsor. Many of you on the call have raised your hand and say, yes, I'll take on the charge to do that. But if you are an ambassador on the call and you are not aware of who your executive sponsor is, or even if you have one, I would say, check in with us. We can let you know who that person might be, and if you have one at all that we have on record. And we're really making sure and really doing a large outreach to make sure that we have executive sponsors at every agency, because we do understand and value that when leadership when leadership understands wellness, that it is trickled down and wellness opportunities are broadened at your agency. Um, and so establishing or engaging with your agency wellness committee. Oh, this is really crucial, right? So one person can't do this job. Even in our teeny tiny agency here, OLR, 150 folks, there takes a lot of people doing this work, right? And we know lots of you are raising your hand, you're voluntold, you may volunteer to do this work, you have other responsibilities. So the more people you have around the table doing this work, the more likely the work will get done. Encourage colleagues to engage with worksite wellness programs and resources. So ambassadors, all of you are receiving our wellness newsletter, our ambassador newsletter, and you get it 2 weeks before everyone else. Well, you get 2 weeks before the citywide newsletter goes out. So I say read it as well as scroll down. There's lots and lots of information in there. And if you just share that information, then you will be able to provide lots of resources to your staff just by sharing the information from the newsletter. And that's like the first step. Set or revise your agency FY25 wellness goals. So using all the data that you have received from us, looking at what the goals are that you've considered in the past for your wellness activities at your agency, looking at the data you received and saying, how did things align? Where's something missing? Using this data to really inform how you move forward is going to be crucial and really important for you to touch on and provide the services that your employees need. I see we did get quite a few things from in the chat. Let me just go up a little bit. So before we get to the chat, we have some resources. We've got lots of resources. This is just a bit of the resources that we wanted to highlight today, and we chose these for specific reasons. We heard from the numbers that employees are indicating that they are burned out. And so we have a burnout video series. It's a really lovely series. It's brand new. We have an instructor guide that goes along with it. So anyone can pull up the resources and really work with their colleagues on the issues of burnout and really offer great resources and things that they can do. We can do as agency and individually to help to extinguish burnout. We have a Let's Talk toolkit for managers and supervisors that has some key terms in there around mental health and some great resources to help you think about how do you have hard conversations. As well as we have a WorkWell worksite toolkit. We know that wellness works at work, and so this is a great toolkit that gives you step-by-step instructions of how to build your program, and also give you step-by-step instructions on how to produce different events at your agency, and it's really great. We have a wellness video library, so almost every webinar workshop that we do, we record, and those recordings are on our Vimeo page. And if you click on that link, you will be able to go to all of our recordings, and you can have a lunch and learn. Just pull up one video, have a few people in a conference room. That's a workshop in of itself. Have a great conversation afterwards. So there's lots and lots of resources, but we are here to help you build. And so these are just the key things, but we're always here to offer assistance if you need it. Next slide. All right, so I'm gonna hand this over to Nadia, who will talk about our ambassador specific resources.
Good afternoon, everyone. So in addition to the resources that Ayana shared, we have also curated additional ambassador-specific resources that you all have access to. So one being the ambassador newsletter that's sent out on the third Thursday of every month. It always includes kind of a way to get involved with us, our upcoming programs, as well as any tools, tips, information, and resources on how you can create wellness programming. We also have an ambassador website that is curated specifically for yourselves. It includes our upcoming programs, information about our upcoming fitness cycles. You're able to locate our workshop request form and a bunch of other information to support your wellness programming needs. I also provide office hours for ambassadors, which is pretty much one-on-one support. If you have, any questions about our programming, need help brainstorming any wellness ideas, we are here to support you with that. We also provide Ambassador Academy resources, which is pretty much workshops designed with ambassadors in mind to help you kind of plan, implement wellness programming. And so the materials from those sessions can be found on the Ambassador website, presentation slides, any if the session was recorded, any worksheets to kind of support you in getting started with planning. And then lastly, our Ambassador Summit is coming up. It's a real nice opportunity to kind of, meet fellow ambassadors in person, network, and kind of get to see the great work that fellow ambassadors are doing, as well as get to know what's to come in terms of WorkWell and the ambassador program.
Hi, this is Ebony. I like to just highlight our champion program and resources because while the programs are there, we want to make sure we're bringing all the colleagues together, and that can be done by the champions. They are the cheerleaders, they are the influencers, and they can be there to support you and making sure the programs have an audience and are bringing the topics that they would like to see. I also send out a newsletter every third of the month, so you'll see the ambassador ones, and our champions will see their own letter on ways that they can involve and engage their colleagues to get together. I also have a Facebook Champion Connect group where we share tips and share the things that are happening at the agencies and kind of just have a spotlight on that information and start a dialogue. I also do offer one-on-one support through a Calendly link to just sign up and talk about the orientation once they sign up and learn ways that they want to get involved and how to kind of flesh out some ideas to help support them as well. And I left my contact at the bottom to get in contact with me if there's any questions.
All righty.